everyone, I'm Michelle Miller.
And I'm Anne-Marie Green.
Right now, President Obama is being briefed on the Zika virus threat. We just learned that 157 pregnant women in the U.S. have tested positive for the disease, according to the CDC.
This is the first time the Public Health Agency has released numbers on Zika. Earlier, we asked CBS News medical contributor Dr. Phillips just how serious this is.
Now, one thing that we sort of have to carve out here, the CDC has not said that these women contracted the virus here in the U.S. Until they do that, we have to assume these are women who either traveled to areas where Zika is prominent, contracted it there, and then came back and became pregnant here, or were pregnant while they were traveling, or they possibly could have contracted it sexually through a male partner who had traveled to a Zika area. One thing, though, that this does, really raise concerns about is if we have people who are carrying the Zika virus here, who are infected here, it's only a matter of time until we start to see local spread. They get bitten by a mosquito. The mosquito then carries the Zika virus and can pass it to someone here within the United States locally.
Well, I know that many of the other countries have basically told women not to have children this year based on the numbers of women who have been infected. What is the threshold for the CDC to make a similar ruling or a recommendation, I should say?
Sure. When Tom Frieden was asked about this, he said it's a little too early in the conversation for U.S. health officials to suggest that women don't become pregnant. Although other countries have done it, we know Brazil has said it. The public health officials in Puerto Rico. I also believe in Honduras it's been said. It's one thing to tell women these are your risks if you contract the virus, so therefore try to avoid areas where you could. It's quite another thing to tell women don't become pregnant. At that point, you sort of cross an area where you're telling women what to do with their body, which is different. On the other hand, we are not in a situation where Zika is widespread here, where we're seeing thousands and thousands of women at risk. That could change.
So if you do you're planning a vacation, if you think you are going to travel to one of these areas, though, how concerned should you be? I mean, if you are considering getting pregnant, should you hold off? Should you wait 6 months?
Here's what I'll say. The CDC says for women who have possibly been exposed, they should hold off on pregnancy for 8 weeks. For men who have possibly been exposed, it's also 8 weeks. For men who have contracted the virus and know that they have had it, they should wait 6 months before they and their partner try to become pregnant, because it can be transmitted sexually in that way.
And I have a twofold question on that. One, if you have had the virus, how long does the infection last? Right. I guess where your child might be infected.
Sure. The general understanding is that the body clears it within a couple of weeks, and that's why the CDC built in a little padding behind that. They said you should clear the infection in a couple of weeks, but try to wait 8 if you can after that. But I also think this really does point to how much we need to focus on efforts to prevent local spread here. It's one thing to say we know we can protect ourselves by not traveling to areas where Zika is endemic, where we're seeing huge numbers. If we start to see local spread here, then theoretically everyone is at risk.
And if you have the Zika virus, if you are infected, does that automatically mean that your child will be
not at all.
I'm having a hard time.
There'll be a negative health impact on a child.
Exactly what you're trying to say. So Zika is unprecedented in many ways. The same mosquitoes that carry Zika also carry dengue fever, yellow fever, chikungunya. What separates Zika is that never before has a mosquito-borne virus, just through one bite, been able to create lifelong, life-threatening birth defects in babies. It doesn't always do that, though. And so we really don't yet know who might suffer that complication and who might not. There have even been cases where a pregnant woman contracts the Zika virus, one child has the birth defect, the microcephaly, and the other doesn't. One twin has it and one doesn't. So there's more, I've said this before, but there's more that we don't know about this virus than we do.
Dr. Hawley, just very quickly, we're talking about if you contracted it, if you get this disease, but what are the symptoms?
Yeah, how do you know?
Could you have it and not know it?
Well, that's another challenge here. 80% of people who contract the Zika virus never know it. They don't get any visible symptoms. Some people, the other 20%, may get some fever, some rash. You just don't feel that great. You're a little bit wiped out. But you also may not think Zika virus. You might think, oh, I just have a cold or a flu or something else. So it doesn't give obvious symptoms, but it does have this very big risk of possible birth defects.
And does your doctor have a test for it?
That is, the question about funding. One of the priorities with funding is to develop a fast and accurate test that can become widely available. Right now, you can't pop in. I'm a general internist. You can't pop into our office and get the test right away. We have to send out to the CDC, and it takes time. We hope to have something faster, as soon as possible.
All right, Dr. Holly, we thank you for this up-to-date information. You're always a great source for us.
Happy to be here.